but lockdown fuel youth health time bomb. New data reveal devastating impact of pandemic restrictions on children's health, while also showing limited impact of the virus. This was November 12th, 2021, by Laura Donnelly, health editor, and Joe Pinkstone, science correspondent. This is on The Guardian. I had to, of course, get it archived, because since this morning, apparently, they've now made it a paywall. So, yeah. COVID killed just 6 healthy children during the pandemic, while lockdowns have fueled a time bomb of health disorders among the young, new data showed. The research examining more than 3,000 deaths of under 18s in England in the year since the first lockdown found a tiny proportion were linked to COVID. Just 25 deaths were caused by the virus, and only 6 of those involved children without underlying conditions. The same year saw more than 1,100 heart deaths among children, along with almost 1,200 fatalities linked to neurological conditions, and more than 450 deaths among under 18s with respiratory conditions, according to research published in the Journal of Nature Medicine. So, what they're saying is what we've known all along is the difference of from and with COVID. But amazingly enough, only 6 didn't have underlying health conditions. So while we know their number, one of the numbers they love during this whole thing is 6, which I believe is like another version of the 33, because what is 6 divided in half? 3, so 33. But I'm sure there's probably more meaning to it than just that. Occult meaning, that is. Meanwhile, a separate study from the University of Oxford showed a 17% fall in diagnosis of childhood cancers in the months following the first lockdown. Researchers found that those diagnosed during the pandemic were twice as likely to be admitted to intensive care before diagnosis, suggesting that the disease was more advanced when survival chances are worse. In addition, alarming NHS statistics showed that the number of children waiting for treatment for eating disorders has doubled in the past year. The official figures show that more than 2,000 children and young people waiting for treatment in September of 2021, up from 860 in a year. Experts said that the slew of data painted a devastating picture of the long-term harm inflicted on children and the problems being stored up for the future. Dr. Camilla Kingdon, the president of the Royal College of Pediatrics and Child Health, said that the study showed very, very tiny numbers of children dying from COVID. Meanwhile, successive lockdowns and social distancing caused far greater consequences through lost education, mental health, and other collateral damage, she said, with much of the impact yet to be seen. There was a view that kids weren't affected by COVID, but what we would constantly try to point out, and which some of this data shows, is actually these are wider issues that are no less detrimental to children and may have a more long-lasting impact, actually, than the virus itself, she said. The children paid a very, very heavy price for the pandemic. Dr. Kingdon said children had paid a very, very heavy price for the pandemic, and she said the impact was seen in many aspects of their health. She warned, you can also see it in community child health services, autism assessments, therapy referrals. We've got a significant backlog to remedy as we move beyond the pandemic. Aspects of child health services have taken a hit because of the pandemic, and there's going to be a long process to catch that up. Professor Russell Viner, a professor in adolescent health at University College London and an author of The Pandemic on COVID Cases, said, when you look at this data together, it tells us that the indirect effects of the pandemic on children are likely to be significantly greater than the direct effects. Likening the actions taken in lockdown to wrapping our children in cotton wool, he warned that the steps taken in an effort to protect them now risk suffocating their mental health. So basically, it's what I've been saying. I said early last year that when you're locking these kids away, you're not exposing them to the germs that they commonly are getting exposed to. Plus, you're affecting their mental health, obviously, from the social distancing. They're not getting the interaction that they need with the world. So it's going to have health effects of their own. And now we're getting studies to say the very thing that we pointed out a long time ago. Now, before YouTube community likes to strike my channel for even talking about this, I like to point out that if you have a problem with what's being said on this channel, take it up with the Guardian, because I'm just reading right from them. So if you have an issue with the information being put out, you can take it up with them and not me, because I'm just the messenger boy reading a publicly uh, written article, maybe behind a paywall now, but it wasn't to begin with, so whatever. Dip in childhood mortalities during pandemic. Official data shows a dip in all childhood mortalities during the pandemic, with most flu and other respiratory infections wiped out by social distancing measures. Really, was it wiped out by social distancing measures, or was it simply misdiagnosis of the C19er in place of these actual diseases? But anyways, but Professor Viner said that this was likely to rebound at us in coming years, with lack of exposure to everyday bugs leaving immune systems more vulnerable. Yeah, no shite. The concern is that what we are doing is storing up problems for the future, Professor Viner said. The study of childhood cancers by University of Oxford examined diagnosis among children and young people up to the age of 25, comparing the period from February 2020 to August 2020 with the same period in previous years. Overall, the numbers diagnosed with brain tumors, leukemia, lymphoma, sarcoma, and renal tumor fell by almost a fifth. The study also suggests cases were detected far later than would normally be the case, with cases diagnosed during the pandemic twice as likely to be detected after admission to intensive care. On Thursday, NHS data showed 5.8 million people on waiting lists for treatment, and the worst accident and emergency performance on record. The monthly statistics showed that numbers of children waiting for treatment for eating disorders had more than doubled in a year. In total, there was 2,083 children and young people waiting for routine or urgent eating disorder treatment at the end of September this year, up from 860 during the same period last year. Experts said the figures were alarming. The study of childhood deaths was carried out by experts from NHS England, Public Health England, and several universities and hospitals who analyzed mortality figures between March 2020 and February 2021. They found just 6 healthy children with no underlying health conditions died as a direct result of catching COVID, including 2 who developed a Kawasaki-like inflammatory condition called PIMS-TS. Separate data shows that on average, about 900 children die annually from infectious diseases, with about 90% deaths from flu or pneumonia among children in 2019 in England. The study showed that more than 3,100 children died in the year following the first lockdown, but only 61 were infected with COVID. Of those, 25 died as a result of the virus, including 19 who suffered from a chronic health condition, most of which were life-limiting. Just 6 deaths involved children without underlying health problems. Now, I'd like to see exactly how healthy these 6 kids were and what they deem or don't deem as an underlying health condition, because I suspect that even those 6 were probably overweight or something. But I digress. Researchers said that during the study period, almost 500,000 under 18s contracted COVID, giving an infection fatality rate of 5 per 100,000 people. That means that if a child tests positive for the virus, they have a 99.995% chance of surviving. With more than 12 million under 18s in England, the researchers said COVID kills 2 children per million. Well, we better rush out and give them the you-know-what, because that will save their lives. because they're at a great risk, right? Speaking of which, hold on a second. All right, so we're over on my Twitter now, and there's been some craziness. Oh, well. Yeah. Screams safe and effective. Someone's post. But yeah, terrible. That's not what I wanted to show you. Sorry, it's not scrolling very quickly here. Let's see. So there's the article I'm reading right now. And I can't make this zoom out better. So we have this mother, and you can see the you know what just pulling on the skin of this kid's arm, and look at his face, and look at her crazy eyes. This is the eyes of a psychopath. Oh, there we go. That's better. The eyes of someone who takes sheer glee in what they're doing to their young ones because they are part of the Branch Covidian cult. This is as close as he got to crying. He was fine as soon as it was done. Yeah, just wait till what happens later on. Oh wait, there's a... Oh wait, I went to the wrong thing, I think. I don't know, there's more. There was another crazy lady here. Another Branch Covidian cultist. Doing the same horrible thing to their young child. Using him as a guinea pig for their own insanity. Paranoia. Sorry, it's really not scrolling very. It's freezing on me. Been having a lot of problems with this tablet and the internet in general. We have another one. Nothing wrong with having your kiddo want to help end the global pandemic. Mine was excited to be part of the solution. Thank you for all you do, Team Molly. It just gets worse from there. Yes, I would like to see your offensive content. Show me more. Yep, I agree. Mass psychosis. But there was oh wait, hold on. Sorry, let me get back to the thing I watched. Up here. This is where crazy takes the cake. Because they're all there's a whole bunch of these Branch Covidians. Kay, this is this woman who, let's see for a second. Let's just take a quick look at her profile before we continue. She's a verified, she's a checkmark person, so that's a strike right there. Proud mama of 3, not for very long. Writer, attorney, finding meaning in the wake of trauma and loss. Authentically sharing it all. Team Molly, making a difference every day. What the heck is Team Molly? This is something to do with doping up your kids with the Molly? This must be Molly. Thank you, science. Team Molly. Let's see your vaccination pics in the comments. It makes me so happy to see the kids and everybody else getting those jabs. Ellie did great. Nothing a lollipop couldn't handle. Yes. Okay, well, I'm gonna go back. Molly preparing for Aladdin in the summer. Okay, so this is one of her kids, I guess. We're not going to read anything personal about that because it's none of our business. We're just talking about the lunacy here. I shared Ellie's vaccination pic and am now receiving insane hate-filled messages from the anti-vaccine lunatics. What a world. And it goes on. Okay, more children being abused. That's horrible. Okay, so let's get to the crazy cake one. The one that takes the cake for insanity. This one here. Can't wait until it's approved for the under 5 so my grandkids can get vaccinated. Their parents are waiting anxiously. Oh my. Anyways, so that's what insane. Okay, hold on. Let me pause this so I can get back. Okay, so let's wrap this article up. While the research was comprehensive and spanned England, it looked only at a time where the alpha and original strains of the virus were present, as the Delta variant had yet to take off in the UK. Researchers said they expected the findings would broadly hold when they are updated, with children at extremely low risk of death from the virus. Meanwhile, Hertfordshire County Council had told secondary school children to wear face masks all the time while they were at school, including during lessons. Pupils have been told to remove their masks only while eating, drinking, or doing strenuous activity such as sport. Okay. Well, there you go. There's a study out now showing the consequences of the actions being taken to guard against a widely survivable virus. Your opinions on the virus, notwithstanding, there's the facts. It's once again proof that the reaction is worse than what is being reacted to. With that said, so before I wrap this up, I'd like to say that this channel is in need of support. You can head on over to my Patreon if it'll load on my crappy internet, just to show you. You can be a member for as low as $1.50 a month. For more perks, obviously, you got your other tiers. You could be a beta plus tier, an alpha plus tier. Oh, what's going on? I dragged my finger too hard. Or see the what I'm cursed with right now? I have 6 at 66 per month. That's bad luck. I need your help, because not only is this channel in need of support, but I need to get rid of that number more than anything. It's really starting to bother me. It's bad luck. I keep tapping to see all levels. There's the Master Edition level. You could be a world controller. If you want to be a world controller, you could go for the gold and go for the 25. But for just as minimal support, be $1.50. No worse than a cup of coffee, especially at the exploding prices with the inflation of food. It's actually cheaper than that now. So in comparison, it's looking pretty good. I also have other ways to support me. You can buy me a coffee. That's a webpage. Just type in Venomous. All the links will be in the description. I do have a subscribe star, but they won't approve me to open it up yet. So I guess if I could get some subscribers, that would get them to approve it fully, so I can have all the perks of posting on it. That would be much better. But yeah, I've put most of my work in the Patreon, secondary to BuyMeACoffee is my secondary one. I haven't really put as much work into that. But if I get more interest, I'll definitely step it up. Anyways, you can also support me through cryptocurrency donations if you'd like, or you can straight up PayPal me. Again, all will be in the description. Thank you very much for your time and attention and putting up with my little spiel about donations. I am Venomous, reporting from the brave new world, and I'll catch you next time.